I'm Maggie, and I am here to tell the story of my complicated pregnancy, complicated childbirth, and complicated last year of my life. The purpose of this video is to help kind of give a patient perspective to this upcoming nursing class. So I guess I'll start from the beginning. Just a little bit of background. I am 29 years old now. When my career as a, when my experience as a childbearing woman began, I was 26. I just turned 26. No medical history whatsoever. Healthy, low BMI, exercised, ate well, no smoking, no drinking, nothing like that. Trying to establish sort of your patient baseline. My husband was 34, 35 at the time, no medical history, no bad habits. None of us have family history on either side. So when we decided that we were going to have kids, we were very confident that it was going to be super easy. Everything was going to be smooth sailing. And I actually am a nurse, and I'm a labor and delivery nurse. I'm also a certified doula. So I very much felt like I know it all. Like, I know how this is going to go. And everything kind of fell apart for a while. So let's start in 2018. I got pregnant for the first time. It took me a little longer than I thought it would. It took 7 months, but I got a positive pregnancy test. I was so excited. My husband was so excited. We immediately told everybody, immediately. And word just spread, and it was such like a joyous occasion, and I felt so good. And I went to my first ultrasound, and I know the staff there. My doctor is also a work colleague of mine, so it was all very personal, and we were so excited. And they did the ultrasound, and I was supposed to be between 8 and 9 weeks, and I guess it was just a sac. I don't even know that there was a fetal pole, was measuring about 5 weeks. So it turned out to be a missed miscarriage, which was obviously very, very upsetting. But the thing that kind of hit me the most was it surprised me. I have always sort of prided myself on being very in tune with my body, and I thought everything was great. And then this test showed me that that was not the case, and it just, it really kind of shook my confidence, because I wasn't aware of what was going on in my own body. So anyway, that was upsetting, and I had a D&E procedure. And then after that, we decided we wanted to continue trying to get pregnant. So after my D&E procedure, I noticed that I wasn't ovulating. And I know this because I was very, very determined to get pregnant. So I started taking ovulation tests and pregnancy tests and, kind of doing all of the, old wives' tales of what you should do to get pregnant. Silly stuff. I think I have this good luck charm on my mantle. I was very, very invested, and I wasn't ovulating. I didn't have a cycle for 60 or 70 days after I had my D&E procedure. So I finally went and talked to my doctor, and he put me on a drug called Provera. And the way Provera works is it's supposed to kind of get your body back on track to doing what it's supposed to be doing. So what you do is you wait 28 days. At the end of the 28 days, or whatever your normal cycle is. So in my case, it was 32 days. For the average person, 28 days. So whatever your normal cycle is, if you don't have a period that day, you take a pregnancy test. If your pregnancy test is negative, you take a pill, or maybe it's 2 pills or something like that. And the next day, if you haven't started your period, you take another pill. And the next day, and so on until you have your period. And then eventually, your body will start to regulate itself, and you'll start ovulating at the normal time. So anyway, I did this for 2 months, And so I took it a total of 2 times, and then the third time I was supposed to take it, I got to the 32 days, and I took a pregnancy test, and it was negative. And I am really good at reading pregnancy tests because I've taken probably a million. And at this time, I was just, very, almost a little like obsessive about it, and I took it, and it was negative. So I was supposed to go to the pharmacy that day to fill the prescription, and I just didn't for some reason. I was just, I had this feeling of, actually, I just want to wait one more day. So then the next day came, and the test was negative, and I still didn't take a pill. And the next day came, and there was a very, very faint positive. So, yeah, I went with my gut, and it was positive, and I was so excited. But, so the reason I'm giving that background is because just to sort of establish that I was very, very aware of my dates. And with a home pregnancy test, there is a margin of error, but typically you're not going to get a positive test before 9 days past ovulation. That's kind of the earliest. So I was able to track about when I got pregnant, and I was very, very sure of my due date. Anyway, so so exciting. We went to the doctor at 8 weeks, and they did the ultrasound, and I didn't even look at it because I sort of had that daunting feeling of like, they're going to tell us there's no heartbeat again, and I'm just going to be devastated. So I didn't even look at it, and there was kind of this long pause, and then she was done. She said, "Okay, great, congratulations, you are due on August 31st." And I said, "Oh, no, I'm due on August 21st." And she said, "Well, according to this, you're due on August 31st. And, this is kind of what we go by. This is sort of the gold standard, a very early ultrasound. And, ovulation is so different with other people. And, you can ovulate early or ovulate late. And anyway, basically saying there's more likely to be a margin of error with my dates than there is with the ultrasound." And I didn't argue that because that would be dumb. And I was so excited. I found out I had a viable pregnancy. But in my head, I was thinking, well, that can't be right. That literally cannot be right. But okay, well, whatever. Because there was a heartbeat. It was 132, and I'm still this very, very healthy person. So met with my doctor. Everything was sort of going as planned. At about 9 weeks, I developed really severe morning sickness. I wouldn't quite qualify it as hyperemesis, but I think I might be kind of underselling it. I was probably vomiting 10 to 30 times a day. I was still working, and on the drive to work, which is about 8 minutes, I would pull over between 4 and 5 times. I threw up in a C-section. I mean, I was very, very sick, but I wasn't losing weight. I wasn't really gaining weight. I was about 101 pounds when I got pregnant, and I was gaining, I don't know, just a couple of pounds, but I wasn't losing weight is my point. So I wasn't malnourished, I wasn't depleted, and everything was just kind of going great. And I went for my follow up at, I don't know how many weeks, it was like 14 weeks or something, and they did the Doppler and heard the heartbeat, and it was so exciting. And I even had like a little home Doppler, and it was just such a great, it was just such a great and happy time in our lives. And we went for the gender scan, is what people associate with the 20-week ultrasound, because that's what we're so excited to hear about. But really, the 20-week ultrasound tends to be very diagnostic of major issues that the baby could have. It's sort of the first time that you're able to get like a really good look at the baby and sort of notice any anatomical anomalies or anything like that. And again, we were not looking for anything to be wrong because we have no history except for that one missed miscarriage. Miscarriages are so unbelievably common. That's not even a red flag. So we went in for 20-week ultrasound, but really I was like 19 weeks and 4 days or something, but definitely close enough. I think it was a Wednesday, and that weekend we had like a gender reveal party planned. I mean, we were just on cloud nine, so excited. And they came in and scanned us. Well, I went in there and the lady scanned me, and I was with my husband, and she said, "Do you want to know the gender?" And I asked her to write it down, and then I immediately read it, but I didn't tell my husband. And she kept asking me, "What was your due date?" "You're sure?" What was your due date that we told you when we did your ultrasound? I'm like, August 31st. Shouldn't you already have this information? It's August 31st. And she was like, okay, August 31st. You're sure it was August 31st? Not like September or, and I was just like, no. And I could see that it had a heartbeat. I could see sort of the form of a baby-ish looking thing. And she was like, okay. Well, the doctor's going to see you soon. And she wasn't that excited for me. And I remember sort of having a little bit of a feeling like, that's weird. Like, normally everyone is so excited when you get to learn the gender of your baby. And then my doctor came in, and he was really serious. And that was sort of the first real inclination I had that, like, something is not right. And I had that weird feeling again of, like, do I just not know my body at all? Because I thought everything was fine. I just thought I was nauseous or whatever. But he basically came in and sat down and said, the baby is very, very small. And I was like, well, yeah, it's a baby. Just still not really picking up the gravity of what he was saying. And he was like, no, this is what we would qualify as an IUGR baby. And I'm a labor and delivery nurse, and I've delivered IUGR babies, and that's intrauterine growth restriction. If you read kind of the older literature, it's intrauterine growth retardation, but that last word is sort of being like weeded out of medical literature. But anyway, and in my head I was like, oh yeah, that's like a baby that's small for gestational age, whatever. And it still wasn't really hitting me, the gravity of it. And he was like, no. So basically the way IUGR works is it's diagnosed typically later in pregnancy. When it's diagnosed this early, those babies, they don't really do that well. And I was just kind of like, what do you mean? Like, what do you mean they don't do that well? Like, just not understanding. And basically when they're that far behind in development, because at this time I was measuring at like 14 weeks, like 5 weeks behind, which is a profound growth restriction. And I was 19 weeks and however many days, so it's not a viable pregnancy. I mean, I'm sorry, if I were to give birth that day, it would not be a viable fetus. So he said, I'm really, really sorry, but basically, we're going to send you to a specialist. The thing about IUGR is there's nothing we can do about it except give you information. Maybe try to increase your calories, but I mean, the problem isn't that you're small, but maybe that would help. Maybe try to get a little more protein in your diet, but there's really nothing that we can do because your body is not providing this baby what it needs to grow and develop. And if you were farther along, we would deliver the baby and, we would be able to provide it TPN and nutrition and whatever it needed. But the baby has to be a certain size to be viable. And I was nowhere close. I mean, it was the size of a, 14-week fetus. Absolutely nowhere close. So anyway, we were sort of told, like, hope for the best, prepare for the worst. And we were given an appointment with our specialist, and they did a ton of blood work on me to sort of try to figure out where is this coming from. And we were just gutted. I mean, it was just a silent car ride home. We didn't know what to say, you know? So we canceled our party, didn't buy anything, um, and just kind of sat and waited to see our specialist. Um, but it was devastating. It was devastating. So anyway, we went and saw our specialist, and they did an ultrasound that took like an hour and a half, and they did Dopplers, and they found out the baby had a single artery umbilical cord. So it was a 2-vessel cord, which is an abnormality. And it's an abnormality that can mean nothing. You know, you can deliver a baby and cut the cord and be like, that's a 2-vessel umbilical cord. Who knew? I've been in deliveries like that. Like, it can be fine, but sometimes I guess it's not fine. Or that could have just been, you know, an anomaly, just a finding. They also saw an echogenic bowel, which they said could be something, could be nothing, but really what they found was this baby is too small to survive. And at the rate that it's going, it's not going to catch up. And there's nothing we can do to help you. So I was told at that appointment that I would come back in a couple of days, but, you know, there's probably not going to be a heartbeat at the next appointment, and just prepare for that. And there's nothing we can do for you. So we went home with that kind of devastating news, and we had like paint swatches for the nursery, threw them all out, stopped talking about the baby. I mean, it was just a really difficult time. And I went back for another appointment. Oh, and they gave me a goal. They needed the baby to gain 300 grams a week to possibly catch up and be viable. So, I mean, I was just eating everything I could. At this point, my morning sickness had gone. I was just kind of doing everything I could, you know, obsessively checking the heartbeat, that sort of thing. And one thing they told me was, you know, if you stop feeling movement, that's a really bad sign, and, you know, you're probably going to lose the baby. But this baby was so small, I never felt any movement. So I just had to walk around, you know, Doppler check to Doppler check, wondering if my baby had died. And so I went back the next week, and my goal of 300 grams, I think he gained 50 grams. And then the next week, he gained like 20 grams. So it was devastating. So they did offer me an amniocentesis to see if that could tell us anything. But again, they were pretty clear that really no matter what this tells us, there's not much we can do, because this baby can't survive inside of you and it can't survive outside of you. But we can do this because maybe it'll give you some knowledge. You know, maybe we can diagnose something genetic going on for the next time or whatever. And we ultimately decided not to have that. The risks of amniocentesis are pretty low, but we just kind of thought, why bother? So anyway, I was 25 weeks. I went in to have another scan, and this is the first appointment I ever went to by myself. And they scanned me, and these appointments are so long, and this appointment was like twice as long. And they were doing Dopplers, which shows like, I guess, like the flow of blood from the umbilical cord to the baby. And oh, just to point this out, I am a labor and delivery nurse. I was so clueless, and so I just felt like I was just brain damaged. Like I couldn't grasp what they were telling me. I couldn't remember anything they were telling me. I just couldn't. I was so helpless, and I didn't feel like a nurse at all. I felt like I didn't even feel like a mom. I just felt like just a person who was completely out of touch with their body. And I was still working, delivering healthy babies on a regular basis. So it was just really traumatic. So anyway, they were doing the Doppler scans, and they said, all right, well, actually, I remember that. So all of this is telemedicine. Also, I go in and have the scan done, and then the doctor would appear on the screen, um, which is fine for healthy people. But when you're sick or your baby's sick, it's really hard to like talk to a television about what's going on. And anyway, the doctor comes in and she goes, well, we didn't see much growth this week, but that's actually not the worst of your problems. So, I mean, it's not good news, but the problem isn't that he's small. Right now, the main problem is you have reverse cord flow. And I was just like, what? I don't even know what that is. She was like, yeah, you have reverse cord flow. Um, basically, blood is like shunting backwards from the cord. It's not getting from placenta to baby. It's not getting what he needs. It is intermittent. Sometimes it's absent, but we're really not able to find any normal flow on you. So here's the deal. We've delivered babies the size of your baby, and they've all died. Even babies a little bit bigger have had profound disability and then died young. I mean, she was very frank with me. She said, I'm really sorry to tell you this, but once you're diagnosed with reverse cord flow, within 7 days, normally the fetus dies. But you're only 25 weeks. And this baby is, oh my gosh, like 300 grams, I think, which anything under 500 grams tends to do very poorly. Anything under like 450 grams pretty much doesn't survive. So 300 grams is not viable. And my belly, I'll include a picture a little bit later. You really couldn't tell that I was pregnant. So anyway, she just basically said, well, I'll call your doctor and see what his opinion is, but you can go home and just wait until you don't feel movement anymore. Or maybe you'll have some bleeding and then you'll know to go to the hospital and you'll deliver a stillborn baby. A little casual about it. Or you can go to the hospital. They'll give you steroid shots to help the baby's lungs develop, but this baby is not going to be able to survive in 7 days. So if I were you, I honestly don't know what I would do. I don't know that it would be really worth it to go and being 25 weeks. And I'm just sort of sitting there. This woman on the television screen who I've never met in person is telling me this horrible news. And I'm by myself, except for the ultrasound tech, who is just like so uncomfortable and silent. And I'm just like completely numb. I don't know what to say. So I left and I walked out to the parking lot and my phone rang. And it was my doctor, who was not on call, I don't think, but he just called me and said, how are you doing? What do you think about this? What do you understand about what's going on? And that's a really important question, because when you're in shock or when you're having something, a traumatic event going on, you really need people to tell you something over and over and over again. So we kind of went over, things are looking pretty bad. And he just told me, he was like, you do have a choice in this. If it was my wife, if it was my family, I would want to say that we did everything we could. And it might not work, but basically, like, we can go home and do nothing, and it's going to end poorly. Or we could try something, and it's probably going to end poorly. But what do you want to do? And I said, well, you know what? I want to try. I want to try. I think I will be able to cope with this loss better if I know I did everything. but I was expecting to have a loss. So I went to the hospital. I called my husband. He came and picked me up. He drove me to the hospital. I've never been sick. I've never been hospitalized. This was so foreign to me to be on the other side of the curtain. So they got me in there. A bunch of nurses came into my room. They put an IV in me. They got blood work. They were really, really nice. But basically, it kind of felt like we were preparing for a delivery. They brought a lot of equipment in there, and it would have been a C-section, but they brought, the Foley catheter in there. They brought the clippers in there, all of that kind of thing, just in case. And the plan was, we're going to give you a steroid shot. In 24 hours, you'll get another steroid shot. And we're going to put you on the monitor, and we're just going to watch, and we're just going to see. And basically, this baby is going to tell us what's going to happen. So we're just going to basically wait until he is so depleted that we have no option but to deliver. And it could be in 45 minutes. It could be in 6 weeks. It could be, nobody knows. Probably sooner rather than later, but nobody knows. So anyway, I feel like I'm rambling a little bit. I should have broken this up into separate videos, but I don't really know where one part of the story begins and the other ends. So anyway, the specialists, the MFM team came in and they scanned me and they did Dopplers and they said, great news. We're not seeing any reverse flow. We are seeing intermittent absent, but that's okay. Not great, but it's okay. We can just monitor this. And I was like, had whiplash from what was going on. So I was so excited and felt really, really hopeful. And, thought maybe I can even go home. I don't have to stay in the hospital. And my doctor came in that evening and I was like, you're never going to guess what they said. They said, actually, it's not reverse flow. It's this and that. And he was just very much, I don't know. I think he kind of felt bad for me. He was like, I really like these doctors. They're very, very intelligent. But the team you saw earlier today, I really like them and they're really intelligent. So let's just wait until tomorrow morning. Let's rescan you tomorrow morning and go from there. And if it looks good, great. And if it looks bad, we'll deal with it when it comes. But before we start celebrating, let's just kind of wait. So it's like, okay, fine, whatever. And the next morning they scanned me and found reverse flow, a good bit of reverse flow. So what we ended up doing, I, again, had no other symptoms. I had no bleeding. My water hadn't broken. I was fine. So we were going to do NSTs every 8 hours. I was going to get the steroid dosage, and we were just going to watch. And every other day, I would have an ultrasound and Dopplers. And he said, if you ever feel like something's wrong, if you start contracting, or like if the baby stops moving, please let us know. And I kind of tried to explain, like, I actually never feel this baby moving. But I don't know. I think I was just trying to be compliant. So anyway, every 8 hours, I would have an NST, and that would last anywhere between 20 minutes, and I think my longest NST was 7 or 8 hours. Very, very difficult to do an NST on a baby that small and on a belly as small as mine was. Very, very challenging, and sometimes my baby would do pretty well, and sometimes he would do really poorly. And anyway, we kept tracking his weight, and he was gaining, but very slow, 50 a week, that kind of thing. And I just kind of shut down. I mean, my entire life had changed. I wasn't living at my house. I was living in the hospital. I couldn't go to work. We are a 2-income household. We literally, our income is 50-50. So now our income is half. I was sleeping in this tiny bed. I felt like I had to ask for permission for everything. It just, so now that it's 2020 and I'm recording this and we've got COVID going on, I can sort of see how lucky I was because I could have visitors and, there weren't those really tight restrictions. But as a patient in that situation, having no control over my life was just, it was really devastating. And I put on a brave face and I smiled and I laughed through it and I joked through it, but I was not doing well. And I have good friends, and I have the medical staff taking care of me was phenomenal. But I was not coping well. I was very sad. So anyway, one night I remember I was joking around with like an extern or a nurse or whatever, and because she was struggling to find the baby, and I was like, so am I the sickest person on this floor? And she said, actually, it's really weird. Reverse flow isn't that common, but there are 4 patients on this hall with reverse flow. It's so strange. And I was like, oh man, am I the worst off? And she goes, no, but I think you're the second worst off. And I was like, oh, ha, ha, ha. That's so funny. And, whatever, like we had a good rapport. It was fine. Anyway, the next day I vividly remember waking up and going into the hallway, and the room across from me had a postcard, or it's like cardstock, on the door with a leaf with a raindrop on it. And what that means in maternity wards is a stillborn or a fetal loss or whatever you want to call it. This person has lost their baby. And it had happened the night before when I was having the conversation about myself being second worst off. And I just walked out and looked at it, and it just hit me like a truck. And I thought, I'm next. Like, my number is up. And later on that day, I ended up being put on magnesium because the baby was doing poorly. And we decided to do neuroprotection with magnesium. Magnesium is a hell of a drug, and I didn't know I was getting myself into, because I've always been on the other side of it, and I'm pretty tough, but basically, it feels like the worst hangover you have ever had. Just, you're very photosensitive, and I had nausea and vomiting. My levels did get up I did have some toxicity. I had too much. I actually I felt like I couldn't see. I had like a really loud ringing in my ears. It's a smooth muscle relaxer, and you really do feel kind of like drunk. So like even calling for help or articulating what was wrong was very, very difficult. Oh, also earlier that week I had to get a midline, which is right here. It's not a central line, but it's like more than an IV. Anyway, it just sort of added to me feeling like, I'm a sick person. I'm going to be here forever, whatever. So anyway, I'm on magnesium, and delivery is kind of imminent. We're just sort of waiting to see what the baby's going to do. And it's actually kind of hard to read an NST when you're in that situation, because magnesium will kind of flatten a baby a little bit. They won't have as many egg cells, and they won't have as pronounced variability. And my baby, who really never had egg cells and much variability anyway, was always kind of borderline. It's hard to tell, like, what is the baby telling you he's had enough, and what is the effect of the magnesium. Anyway, it was just very stressful and long. But after doing that for, it was like 24 to 30 something hours, I was on there like a little longer than I thought I was going to be. They did another scan and they were like, actually, I think we might have a couple more days. I think we might have a couple more days. We'll just see. Because the baby's not looking good, but he's still too small to deliver. So when it comes to a baby this small, if there's any hope of this baby surviving, you just, it's a risk benefit analysis of, is it safer to be inside of me or outside of me? Inside of me where my placenta is failing, where he's doing poorly, or outside of me where it's possible that he is still so small there is not equipment anywhere available to resuscitate. So can we push it and get him a little bit bigger? Can we get him just a little bit bigger? So that was what we were doing every day, and it is very, very stressful. Also, I couldn't feel the baby move, and I had this huge disconnect with my body. So every time they would do heart tones or do an NST, I mean, it was, I don't know, if there was always the chance that there could be no heartbeat, and I wouldn't know until they did that test, and it's just really hard. And you get, NST every 8 hours, vitals every 4 hours, doctors coming in and out, visitors coming in and out, and the cleaning people and the dietary people, and you're not sleeping. And, you just, oh, it's not a life. It's not fun. Anyway, some more days went by, and we said the farthest I could possibly take this pregnancy is 32 weeks. After 32 weeks, the baby's got to come out, so let's hope that he's big enough. And one of the doctors of the NICU came and sat down and talked to me just to kind of talk about delivery and what my expectations were and what I wanted. And he kind of explained what would happen. And he basically said, if this baby is too small to resuscitate, we can try, but there's a chance that we could do, when we're trying and failing to resuscitate him, we could do tissue damage. His face might not look the same when you get to see him. It could be a very traumatic thing to happen. There's a chance this baby could be born alive and only, alive for a few minutes. And I was very determined that I want to see my baby alive. I want to touch my baby alive. Even if it's not for very long, this is what I want. I don't want him on the table while they're trying to do all of these things and failing just to satisfy me. And also, I don't want him to suffer. I don't want that. I want, if we're going to resuscitate, it needs to benefit his life and not just mine. So this was a conversation I was having to have. And I was having to have this conversation with my husband. And we just basically said, we want to do everything we can, but don't let him suffer unnecessarily. Because no matter, don't let him suffer. That's my soapbox. So anyway, I made it to 29 weeks, which is huge. Nobody thought I would make it that far. It was awesome. My belly hadn't grown at all. The baby had grown a little bit. He was now measuring like 470 grams or something. And the ultrasound, it's not perfect. I think it's like plus or minus 50 grams is sort of what you can focus on. So it's like, well, if it's plus 50 grams, great. He's 500. He meets the criteria. If it's minus and he's just 400, that's really bad. I mean, that's, when you weigh so little, 50 grams is huge. So anyway, I had an NST, and it was very, very long. It was like an 8-hour long NST, and the doctor on call came in, and basically said, we're going to put you on magnesium. I don't know how, and we're going to leave you on magnesium until this baby says he's had enough, and then we're going to have to deliver. and then I don't know what's going to happen. I had another round of steroid shots when I had my first dose of magnesium, and you can't have a third round of steroid shots, I don't think. I got the maximum, whatever. It's all kind of a blur. But basically, we're going to put you on magnesium, this horrible, horrible drug, again, and we're just going to see what's going to happen. So I said, okay. And they put me on magnesium, and I'm on constant monitoring for this. I have a catheter. It just sucks. It sucks. And I've got the volume turned up on the machine, and I can hear his heartbeat, and he starts having decels, horrific decels. And it's almost absent variability. He's just doing really poorly. And he would have a decel that lasted 3 minutes, and his heart rate is in the 50s. I mean, just really awful. And the nurse and the doctor would come in there, but then he would recover, and he would be doing okay, and they would say, okay, let's wait just a little bit longer. Let's see if we can leave you on magnesium for just a little bit longer. And as the day went on, I was ready to go to the back, and I had to have a C-section. That was always the case, and we knew that I was going to have a classical cesarean section, which is it's an incision in the uterus that is vertical rather than the normal horizontal one. And I think this is so that it's like a less traumatic birth for the baby. I don't even think I asked. I was just traumatized out, and my brain is dead. So anyway, we just spent hours and hours and hours listening, and every now and then, well, actually probably every hour, he would do something that was like, is this it? Is this baby dying? Is he, his heart rate's in the 40s, it's in the 30s, oh, now it's in the 70s, now it's 100, and now it's back down, just waiting and waiting and waiting. And finally, that evening, we had another big decel, big long decel, and my doctor came in and he said, this isn't getting any better. Maybe he'll come back from this decel, but I mean, I think we've established he's ready to come out. I don't know if he's big enough. At this point, it doesn't matter, because if we leave him in you, he's going to die. We have to try. And I said, okay, let's try, let's do it. So we are going to the operating room, and it's not an emergency C-section, but it is an urgent C-section. So we go to the OR, they sit me up, and it was decided that we would do an epidural for anesthesia for post-op pain control. Was the primary reason that my doctor had chosen this method, and I was fine with it. So the CRNA bent me over, and she stuck me. So she did a little bit of local lidocaine, which is completely normal, and then they stuck like the big needle, and I knew something was wrong. So I was just like, nope, get it out. That's not right. That's not right. I've seen this done 100 times. This is not what it feels like. Like, this is wrong. So she took it out, and nobody ever used local lidocaine again. And she stuck me again and again and again, and it was horrible. And she would do this, she'd stick it in and take it out almost all the way and then bend it. And I mean, this is all going into my spine. I can feel everything. I am like shaking and in tears. Finally, the anesthesiologist comes, and he tries, and he can't get it. And I'm literally this size. It shouldn't be that difficult, but I don't know. Maybe I don't know what the problem was. But I was stuck over 5 times, like with take it completely out, put it completely in, over 5 times. I know this because afterward I had 5 very distinct holes in my back. So they like rolled me on my side, did it again, and at this point, it's been like an hour since the baby's been on the monitor. So it's suddenly becoming a lot more emergent. Like, okay, we gotta go. We really, really need to go. So he finally gets it in and rolls me over, and he's touching my legs and saying, can you feel this? And as he's doing that, he has his hand up, I'm laying like this. He has his hand on my belly and he's touching my legs, the anesthesiologist is. And I said, I can't feel my legs, but I can feel your hand on my abdomen. And he goes, oh yeah, that's normal, that's normal. But you can't feel your legs, right? And I was like, no, I can't feel my legs, but I can feel my abdomen. The baby's not in my legs. You're about to cut into my abdomen. I can feel that. And he was like, okay, well, like it's fine. And at this point, my doctor's kind of like chomping at the bit, like, we really, really need to go. So he does the incision very, very low, and it's a horizontal incision in the skin, and it's low. It's about right here, and I can feel the pressure of it, but it's not painful. And he's like looking at me as he does it, and I said, okay, that's fine. I didn't. That's fine. We can keep going. And then they put the surgical retractor in, and they pulled back, and I was screaming and screaming and screaming. And I felt everything. Absolutely everything. Because I wasn't numb up here. And what can you do? Because if they were to put me to sleep while that baby was still inside of me, those drugs would have gone to the baby. And the very slim chance he had of surviving would be gone. Because they would make him sleepy and unable to compensate. But I was there, wide open, on the operating table, feeling it. So they just moved quickly, and he began using local lidocaine with every cut. It didn't help much. And they put a mask over me with gas, but no one was holding it, so it was just sort of sitting there. And I was trying to hyperventilate because I thought maybe I would pass out. And I know it wasn't a long operation, but it felt very, very long. And I was screaming and screaming and screaming. And they got the baby out, and apparently he cried, but I didn't hear it because I was screaming. And they, as soon as the baby was out, they put me to sleep. And when I woke up, I was just totally in shock, and I asked if my baby was alive, and they said yes, and took him to the NICU, and he actually made a sound when he came out. And I was just sort of overwhelmed. And I still had the drugs in me, and I felt good, and they took me to recovery. And about 5 minutes later, so I had the epidural that's my pain control, the epidural that failed me during surgery. So the pain medication that they gave through my IV, or whatever they gave me to go to sleep, has now all been metabolized and is gone. And suddenly I just feel, it was like someone set me on fire. Just this horrific, horrific, horrific pain. And I kept pressing the button to get more drugs from the epidural, and my nurse kind of started panicking because I was just screaming and sobbing and shaking, and it was just horrible, absolutely horrible. And the only pain relief I had was this epidural, and it wasn't doing anything. And she called the anesthesiologist and called and called and called, and it was at shift change, so a new person had come on, and I mean, it was so long. It was so long. And I was panicking and screaming, and my nurse was in tears and just apologizing. And they finally gave me medication through my IV, 1 milligram of Dilaudid, and I felt so much better. And that was enough to get me from my room from the post-op room to a recovery room. And then all I would have is my epidural. But I got an update on the baby. He weighed 540 grams, which was insane. He might have a chance, but maybe not. So the next 24 hours was critical. And they said, once we can take the epidural away, we'll give you some Percocet, and then we can take you to the NICU to see your baby. But, we just have to wait for your pain to be under control. So I just shut up. And I kept hitting my button, wasn't doing much good, but I was like, I have to get to the NICU I will crawl there. I have got to see my baby because I want to see him alive. So I just sort of sat there. And my nurse knew something was up. So she kept kind of gently checking on me. Is your pain okay? You okay? And I was like, I'm fine. I'm fine. Like, don't talk to me. I'm fine. I don't want anything. I just, like, let the timer run out. Take me to the NICU. So she came in and she said, this is when they were going to take the epidural out. And she said, okay, be honest with me. Were you actually getting pain relief? Like, you look like you're hurting. And I said, maybe this just isn't my drug because I am having a side effect. I'm sweating. Like, my sheets are soaking wet. My back is so sweaty. Maybe I'm just having a side effect from the drug, so I guess I'm getting it, but it's not providing me pain relief. But that's okay, whatever, I'll get Percocet. So I tipped forward, and she took the tape off, and she just paused, and then said, this wasn't in your back. It was just sort of sitting there taped. So that sweat from the epidural, it was fentanyl and Marcaine. All of that medication was just soaking my sheets and not getting to me. So that explains why everything went so poorly, because the epidural had gotten displaced. I don't know when it happened, but it was very bad. My suspicion is when they put it in and then rolled me to start the operation is when it got pulled. But whatever. Because I had something more important to think about, I had to go and see my baby. So anyway, they wheeled me down and I got to see my baby for the first time, and I'm gonna put a clip of that right here just to sort of break up the monotony of me talking. So, alright, I will put that right there.
Hey, almost if I get you just you see the class. Enjoy it. Call me if it's I gotta go.
Look at those guys.
Yes, very heartwarming. Anyway, so 540 grams. We knew we had a long road, but there was hope. And the next day, I actually got to go home the next day. I insisted. But we got to visit him in the NICU, and having a baby in the NICU is just not what I thought it was going to be. Really, because I had never thought about anything like this before. None of it had ever crossed my mind. But I went in and I couldn't touch my baby. Also, he was 11 inches long, very, very small. I'll include a picture of him when he was born. And he was on the oscillator, and he was on pressors, and he was on nitric, and he had a hole in his heart, and he had gosh, what else did he have? Anyway, so for 3 days he was on the IVH protocol, which is intraventricular hemorrhaging, which is basically they don't want to do anything that is going to neurologically stimulate this baby because it increases the risk of them having a brain bleed. So that's lights, sound, touch, that kind of thing. Couldn't touch my baby. And it was just terrifying because he would just lay there and not do anything, and the machines are loud, and he would just, his oxygen would drop, his heart rate would drop. He just wasn't doing very well. And then about a day later, he looked like this next picture. So, using your nursing eyes, what can you tell me about this baby? What is very abnormal when you look at him? He had developed bronze baby syndrome, which I had never heard of before. So he turned that very, very dark color and just started looking sicker and sicker. And he was on the nitric treatment, which normally you would be on for like maybe a day or two. We couldn't get him off of it. Could not wean him off of it. He started third spacing really, really badly. So this teeny baby, a day later, became like this. His head was swollen, his body was swollen with just fluid. He couldn't regulate anything in his body. He looked like he was dying. It was really bad. So 29 weekers typically do really, really well. And a lot of them don't even need to be intubated. He was intubated for 6 weeks. That's a very, very long time. And he was on the oscillator for 6 weeks. He was never even on a regular ventilator. And if you do poorly on the oscillator, there's kind of nowhere to go from there. So he had this bronze baby syndrome. He developed pulmonary hypertension. He developed very severe thrombocytopenia. He had over 30 transfusions of blood products. We just stopped counting at 30. He was on TPN. Everything, just everything. And I think it was 10 days before I got to hold him. And when I did, he was on the oscillator, which has a very rigid tube. And every time I touched this baby, he would start to decompensate, and he would brady, and he would become hypoxic, and it would take him a really long time to recover. And it was horrible. It was horrible. So I was in the NICU for about 16 hours a day, every single day, just staring at an incubator. It was like having a pet turtle. And I would just watch the monitors, and he just did really poorly. And this went on so he was doing really, really poorly for, 3 weeks or so. And then he kind of started to stabilize and do better. And then he got an infection. He became septic. And he was really, really sick again. So all of that progress we had made backwards. And it was really, 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 he was really sick. And the only thing that really kept me going through that was the nursing staff. They were incredible. They absolutely took such phenomenal care of us and really guided us through the world of being NICU parents. And I do remember having a couple of nights, I talked to one of my NICU nurses and just said, at what point are we going to say enough is enough? He's suffering. I don't know if he's going to get better. Do you think he's going to get better? What are we going to do? And she was honest with me and said it could go either way. These are the signs you need to look for if he's circling the drain, that kind of thing. I later found out that one of my best friends was there with me one day, and I had left the room for some reason because I was pumping like crazy, pumping every 2 hours. I got mastitis 7 times, postpartum, 103 fever, horrible. I've just had horrible luck. Horrible, horrible, horrible. Anyway, I left for some reason, just out of the room, and the day shift nurse was changing shifts, and I hadn't been able to hold the baby that day because he had been overstimulated, and I was only able to hold him like every couple of days for a little while. And she did say to my best friend, make sure night shift lets her hold this baby tonight, because I don't know that he's going to survive. I don't know that he's going to survive the evening. Just please advocate for her. I'll advocate for her, but please make sure she holds this baby tonight. And she didn't tell me that at the time. This is the story I heard later. So it was bad for a while, for a long time. And we just kept on trucking, plugging along, and then he got better, and then he got MRSA, and that was terrible. And it's just a very difficult thing to watch happen, because he was having blood work every day. And when he was first born, and in the first couple of weeks, his eyes were fused. His ears were still transparent. He seemed very underdeveloped. During the IVH protocol, they had his eyes covered and his little head covered and kind of everything. And I do remember when they took that off, his ear was folded. It had been folded under, which, I mean, it didn't strike me as anything, but he was on pressors during that time. So a couple of days later, his ear, it was a perfect line. The tip of his ear turned black and fell off. The tissue had become necrotic because it became hypoxic, because it was folded, but really it was because the pressors, just kind of the perfect storm, was folded over while he was on pressors, so blood was being shunted away, and he lost that part of his ear. But he didn't cry for weeks and weeks of his life. He was just stuck by needles. I remember one day I came in, he had bilateral PICC lines. He was intubated. He had an OG tube. He had an IV in his head, an IV in both of his feet, and an IV in his arm, or his hand. And it was just really hard to watch. But anyway, the days turned into weeks, and eventually he started doing a little better. And he started acting not like a normal baby, but acting like a living thing, where he would react or wake up or just something. And actually, I'll put a clip of him while I was holding him. He's on the oscillator. This is just kind of cool. Milo. Milo.
Oh yeah, there he goes.
Milo.
Oh my gosh.
How?
Oh my goodness.
So anyway, after 6 weeks, they extubated him. And I think it was at that point he was exactly 2 pounds. And they extubated him, and they put him on CPAP, and he did it. And that's when we could kind of see, like, we might actually go home. So we bought stuff, and we painted a nursery, and yeah, it was great. It was phenomenal. But this baby was still incredibly sick and very, very, very fragile, and still having episodes. But there was a light at the end of the tunnel. So anyway, about 80 days into it, he's still on oxygen. He's still completely tube fed. The rationale with that is he was so small, and his lungs were definitely his biggest problem, because his lungs were causing his heart problem, and that was just sort of a major thing. He was burning more calories than he was getting if he tried to eat by mouth. So we just did tube feeding, because we need him to be bigger, because we need his lungs to be bigger, because we need him to grow more alveoli, because the ones he currently has are just awful and damaged from the ventilator and from being premature and whatever. So completely tube fed. They did an MRI and found PVL, which is holes in the white matter. About 75% of these kids go on to be diagnosed with cerebral palsy, but at this time, you can just see PVL. But he was doing better, and we were not talking about discharge soon, but just entertaining the idea of discharge. And I got a call one morning from his nurse and said that they ended up having to bag him that night, which, had this happened weeks and weeks ago, that wasn't that uncommon. It had happened a couple of times. But at this time, he was a full baby. He was a baby that you could hold, that would cry if you stuck him with a needle. I mean, he wasn't having transfusions every day. He wasn't intubated. Like, what happened? So basically what happened was he pulled his NG tube and it made him vagal, and he could not recover. So he became bradycardic, stopped breathing, and they had to bag him. So this is pretty bad. That's really bad, because as he gets bigger and older and wants to pull things, which is good, he could code. So it was just devastating and scary, and we just had to be very, very, very mindful of nothing getting pulled. So anyway, 92 days later, we are discharged. And this is September the 16th, and we were told, you know, we're about to really kick off flu and RSV season. You guys need to isolate. Don't let people around this baby if they have the sniffles, because if he gets RSV, if he gets anything, you will be back in the hospital, and it could be devastating. So just be very aware. We were sent home with a bag to bag him. He had an NG tube. He was on oxygen 24/7. He was exactly 5 pounds. So small, so fragile. But we got to take him home. We a month later, he had surgery and had his G button put in. We stayed very, very isolated, but we had to go to doctors all the time. We were averaging about 5 appointments a week. He would fatigue. He would have a couple of bradycardic episodes, would have times when his oxygen would drop. It was a very, very, very scary, scary time. But we had our baby home, and it was amazing. And he was doing okay. He was still kind of a lump, but he was doing okay. My husband and I were not sleeping. It was just a very trying time in our family. But the fact that we were here in a place that we never thought we would be was just remarkable. So anyway, he starts doing well. We go to speech therapy. We go to physical therapy, and he's behind on his milestones, but he starts doing really, really well. And I am still pumping and just saving this milk because he has some weird allergy and he has to be on a specialized formula, but I'm still pumping all the time, whatever. I am also taking birth control. So when you're like breastfeeding or pumping, people say it's like harder to get pregnant. I haven't had a cycle. I had bleeding after my C-section, but I've had a cycle or anything like that. And it is the beginning of November. And also just consider my lifestyle for a second. You know, we were in the NICU all day long, and now no one's getting any sleep. We're terrified. We're just staring at this baby all the time. I'm not exactly, I'm not terribly active. So anyway, in November, I start getting sick, and I don't know why, and it's probably just stress and whatever. And I, kind of brush it off. And the baby is starting to do better, and he's, maybe like 6 pounds at this point, and I'm just not feeling well. I thought it might be depression. I didn't know what it was. And I took a pregnancy test, and it was positive. And I was devastated. I had fought so hard for this little baby. And so when you have a classical cesarean section, you can't carry a baby to term. So any baby I have from now on is going to be premature. And hopefully not as premature as my son was, but they're going to be premature. It will be a high risk pregnancy. I will probably be hospitalized again. And getting pregnant after having given birth so recently was very dangerous. And I just thought, I have to be here for my son. I can't go to the hospital for 30 days. I can't be sick. I can't do that. It's not an option. I couldn't work, so we were operating on 50% of what we were used to our income being. I was billed over $2 million from the NICU. Um, we were just hopeless. I mean, we were just so devastated, and it was so unfair to me because the first time I got pregnant, it took a long time and I tried really hard, and the second time I used medication, and this time I was taking birth control appropriately and I was pumping and I was damn near practicing abstinence, and I got pregnant. So I talked to my husband and I called a clinic in Atlanta, and a few days later I went to Atlanta and I had an ultrasound and I had some blood work done, and I took some pills and I terminated that pregnancy. And I'm telling this story just because there's a lot of emotion around abortion, which is understandable. But when someone pictures someone who's had an abortion, they're not really picturing me. Um, they're they're sort of assuming that you've been irresponsible or that careless or something like that. But for me, I truly felt like this was my only option. This is the only thing I could do, and I stand by my decision. I think it was absolutely the right thing to do for my family. And abortion is just kind of part of women's healthcare, and it can be a part that you agree with or not. But as a healthcare provider, it happens, and it happens for all kinds of different reasons. So I just wanted to share my reasons. Um, anyway, yeah, so that was November, and in February, Milo came off of his oxygen, and he doesn't use oxygen anymore, and he still has a G button, but we're working on it, and he is now sitting up, and he's babbling, and he is rolling, and he is doing everything that we never ever thought he was going to do. So anyway, I'll bring him on in a second, but yeah, I want to tell my story, and I'm sure I missed a lot of things, and I'm open to receiving questions or whatever. But anyway, yeah, this has gone on long enough. You know the whole story now, so I hope you got something from it.